Hi, everyone. My name is Dr. Olga Degtyareva here at Paramus Dental Arts. We get asked a lot of questions about dental crowns, so I'm here to answer a few of the most frequently asked questions. So dental crowns are a cap that goes on top of the tooth. It is a 360-degree coverage that gets put on the tooth to prevent breakage or any other issues that may arise. What are alternatives to dental crowns? Well, it depends on what the crown is being done for. Sometimes a filling can work, sometimes an extraction is necessary, sometimes there's really not many other options and the crown is the way to go. It really depends on the situation in the mouth. So there's actually lots of different types of dental crowns. It all depends on the material that the crown is being made out of. They can be as simple as all metal, very attractive black crowns, all the way up through beautiful, aesthetic, all porcelain crowns. There's mixtures of the two. There's new materials that come out on the market every day. So it varies a lot depending on the needs of the patient. So as far as the different materials for the dental crowns, and advantages and disadvantages of each. So let's talk about those. So we have very basic all metal crowns. Advantage of them is that they're fairly inexpensive, relatively inexpensive, but they are highly unaesthetic. A nice black blob sitting in your mouth. Very attractive. There's other options of all porcelain crowns. They are much more aesthetic. They are very, very strong, but they come with a higher cost associated with that. There's other materials such as zirconia. That's very, very strong. It's fairly new to the market, but super strong material. Excellent, excellent for back teeth. Can be not as aesthetic, so I don't always recommend it for the fronts, but it depends on what we're doing. Is a dental crown necessary after root canal treatment? Absolutely yes. So the reason to that is because after a root canal gets done, teeth get much, much more brittle, much, much more likely to break, particularly back chewing teeth that you use to eat with every day. So in order to minimize the chance of this tooth breaking in half and having to get it extracted, we always, always, always recommend to put a crown on top of this tooth. So the dental crown procedure has changed slightly over the years. So in the past, the typical procedure was you come in, we prepare the tooth. In other words, we shave the tooth down. We take an impression, used to be a typical mold of putty that gets put in your mouth. That gets sent out to a laboratory, and it takes about 2 weeks or so to get made. In the meanwhile, we make you a temporary crown, so you have a tooth there just for those couple of weeks while we're waiting for your permanent crown to come in. Today, thanks to modern technology, we can do all this in the same day. You don't even have to leave, and we don't need to make you a temporary crown. It takes about an hour or so to make it in the office, and you can leave with a permanent crown that same day. Does the dental crown placement hurt? Typically no, but it depends. So if the tooth is root canal treated, meaning there's no nerve, the tooth is technically a dead tooth, there's nothing to hurt. It's super easy. We cement the crown in, clean up any excess cement, adjust it as necessary, let you go home. However, if the tooth never had a root canal done, it's vital, it's alive, the nerve is still there, this tooth may be very sensitive for the crown insertion process. So sometimes we recommend to numb you just to make your life a little bit easier when we put the crown in. Are there consequences for getting a tooth crowned? Well, sure. We have to do a 360-degree shave of this tooth in order to put a crown on. So if it's a perfectly healthy tooth and now I'm removing tooth structure around all sides of it, yeah, there's consequences to that. There's nothing better than your own natural teeth. Our dental materials come very close. Your own teeth. So let's talk about the consequences of putting a crown on your tooth. So it is a foreign body that's going in your mouth. I've had instances where patients have allergies to the materials that get put in, and we've had to take the crown off and make it out of a different material. We've had instances where, unfortunately, the crown breaks or pops off. That can happen, though very rare, but it can happen. And you just come in, we re-cement it, and let you go home. Sometimes it is necessary to put crowns on baby teeth. And in that case, it's only when there's a really big cavity in a baby tooth that requires a root canal. And in order to, again, keep this tooth from breaking, we put a little crown on top. It is not the same as the crown that is done on an adult tooth. But again, the whole purpose of the crown on a baby tooth is to not let it break while the tooth is still in the child's head. The way we do our crowns in our office is that they should always look like normal teeth. Nobody should be able to tell that you just had some work done. That is why I highly dislike all metal crowns, because now you have a big black blob in your mouth and anybody can tell that you just had some work done. The whole point is it should blend, it should look natural, and nobody should ever have to know that you had something done in your mouth. You can absolutely get cavities on crowned teeth. So the crown itself will not decay. There's no issue with the crown itself, but there is a border between where the crown meets and the tooth begins. And along this edge, you can absolutely get decay, and you may result in the crown needing to get replaced. So it's very, very important that you keep teeth clean and all your crowns clean and brush and floss and come in for your regular dental checkups so we make sure there's no issues. I expect dental crowns to last bare minimum 5 years, usually at least 10. I've seen crowns last for 20, 30 years. So it all depends on how well you take care of them. Insurance typically pays for crowns. They never pay for everything, but they will usually pay for something. So thank you to them for paying for something. In order to schedule an appointment for a crown, all you have to do is give our office a phone call. So I hope I've been able to answer some of your questions. If you have any others or anything was unclear, please feel free to reach out to us, 201-845-5533. Thank you.